Hi, I'm Jeff Albertson, physical therapist at Vasta, performance training and physical therapy. I'm going to go over just a real brief demonstration of an example of what to do when your muscle cramps during some sort of an exertional event. So you're running, typically an endurance race or event of some sort, and you pull up lame, most commonly quads, hamstrings, calves, and what everyone intuitively does is stretch the muscle, which is effective treatment for most exertionally related cramps. So what I'm here to kind of suggest to you to do is take advantage of neuroreflexive mechanisms that are built into our bodies that help decrease tone in muscles. So we have reflexive mechanisms that say to our muscles, when one muscle is activated, to decrease the tone and the level of excitability to the muscle that would inhibit the muscle you're activating. We can take advantage of this when you cramp. If, for instance, you get a calf or you get a hamstring cramp during exercise, what most people do is they, grab a hold of something and immediately kind of stretch that hamstring real hard. What I would suggest you do is get yourself into a position to stretch the hamstring, but lightly ease into it and contract your quadricep, or the muscle that opposes the hamstring, first. By straightening out your knee and tightening your quadricep muscle, you'll automatically get a little bit of a relaxation response, maybe a real strong relaxation response in that hamstring. And after doing that and settling into that for just a second or so, go ahead and then apply a gentle stretch and hold it. You can do this with the calf muscle too. If your calf is cramping, what we typically see people do is they hit the ground, their friend comes over and jams their toes up into their knee. If this happens to you, lay on the ground and pull your toes, actively pull your toes up towards your knee first. Take advantage of that neuroreflexive inhibitory response to the calf muscle, and then follow that up with a stretch. It might prove more effective, and it will most likely be less muscle damage done, and probably a reduction of the delayed soreness that you might feel 2-3 days later, as compared to having a cramp and just cranking it right on stretch passively all at once.